talk about such a significant issue as the notion of single-payer healthcare. We need, of course, as you all know, or you would not be here today, we need to transition to a single-payer system in our nation if we're to have a just and fair system, if we're to deal with the things like racial inequality that exists in our system. As we're in the midst of this seemingly never-ending pandemic, we know how significant it is to not have to worry about the cost of healthcare, to be able to seek treatment without a concern about whether or not you'll be able to afford it, whether or not it will break you if you get sick. We need to move towards this kind of system, and even to prevent us from getting sick. How do we worry about health care as opposed to sick care? All of these reasons, and those of you who might be more fiscally minded, it's also the most affordable way going forward. So I'm just glad to be able to come here today and talk a little bit about this issue, and to have some time with Chuck, sort of having a conversation about what the faith community can do in order to support this larger initiative.
And I think we need to have an honest conversation with ourselves about our secularism problem, which is to say that we need to be welcoming for any number of reasons. Any number of reasons we need to be welcoming of communities of faith, folks who may not look like us, folks who may not have our same income level, live in our same neighborhoods, worship in different places, or see the world with a different mix of values. But what we do is we have a core set of values that unites us, and that is we care for people. This has roots, as Rodney's going to share, in biblical testament. And this is what is important, that we not shy away from using words and language that may not be completely comfortable to us, but we've got to build these relationships. And so the thrust of this sort of interview style that we're going to do here with Rodney is, how do we maybe even begin with the question of why do we need to do this? How do we need to do this? What does it look like to build relationships, meaningful, lasting relationships that will produce trust and ultimately political power to do the morally correct thing, which is to get healthcare for all. Transformational politics has got to be done with folks who share our values, and to approach them in a way that's going to make this effective. So you spoke last week about the need to connect our common morality and translate that into truth, and to use evidence in support of that truth, and then translate that into action, political action. So maybe you could speak a little bit about the process. I think you called it like pedagogy or methodology of how do we build these relationships, and maybe just start with the first question of, why do we need to build these relationships? Why is it so important to your work and the work of others?
Thank you so much, Chuck. I appreciate that question. Just as we get started, I think when we think about faith communities, we often think about people of faith isolated in distinct buildings around the country. We think about them as places where people go on Friday, Saturday, Sunday, to participate in worship services, to pray, to learn more about their faith. But we don't get to what the heart of most of these faith communities really are. Most of these faith communities are the byproducts of organizations, or dare I say, movements that began for human liberation and human development. I see skeptical faces here. What is the Jewish faith if not a movement for liberation and freedom? God comes in the beginning of the book of Exodus to a group of people who've been locked away in enslavement. God liberates them from the oppressive hand of Pharaoh. God gives them the promise of a land where everyone will have their own land, and everyone will be able to grow their own food, and everyone will be able to participate in their own ability to relate to their own God and their own governance. this is, I mean, if we think about it, and how does the whole story of the Hebrew people begin? It begins with a march from bondage in Egypt to freedom, eventually in the land of Canaan slash Palestine. Uh, the fundamental thing I want us to get is that the Hebrew faith starts off as a movement for liberation, a movement for social justice in the midst of the world. And those of you who are Christians, if you look at the New Testament, you'll realize that Jesus is a Jewish man in the midst of a Greco-Roman world who comes from a marginalized society, a city of Nazareth. What good can come from Nazareth? He, early on in his ministry, organizes small towns and small communities in the Galilee. He sends people out 2 by 2 to these different towns to get them ready for his coming. He says that I've come to bring the kingdom of God, i.e., having an alternative governmental system than the system of Pharaoh that is so oppressive that governs, Pharaoh, Caesar, that is oppressive and governs the land. He, in essence, develops what he calls what is a movement. He marches around the small towns in Galilee, and then he makes his march down to Jerusalem and confronts the authorities that are there with this larger gospel. The kingdom of God is at hand, i.e., a time when God rules is at hand. And all along the process, what has he been doing? Well, he's been providing free healthcare for people. We read that as he was healing sick people along the way. He was taking care of people's mental health. We call that casting demons out of people. He was feeding people who were hungry. He was making sure that those who were marginalized and had been left out of society were welcomed in, like we might do with immigrants today. In essence, Jesus's movement was a movement for social justice at its core, a movement for the uplift of humanity. So the first thing I'd say is that when we talk about trying to move towards a healthcare justice paradigm, moving towards a single payer system, moving towards something that will provide more just access to healthcare to all of God's children made in God's image, we are speaking the language of the synagogue, of the church, of the mosques, of the temples of our world. We are speaking a language that is familiar and resonates. We need to make sure that as we talk about our message, we can frame it in ways that are comprehensible to these faith communities, ways that they will recognize, this is similar work to what Moses was doing, what Elijah was doing, what Jeremiah was doing, what Jesus was doing. We need to help everyone to see that there is a deep and enduring connection between the work that God came to bring. I love the way Walter Brueggemann talks about it. He talks about the role of a prophet, and I'd say that we have a prophetic responsibility in part as people in this movement, is to provide God's alternative vision, i.e., what should be in this world, and juxtapose that to what is in the current reality. The is unjust. The is self-perpetuating. The is wants you to believe that this is all there can be. We can't have another system. We're stuck with the system that we have, and to change the system would imperil our ability to have a democracy. No, the alternative vision that is presented by all of these faith communities is a better world in which no one is denied access to healthcare that they need to survive, where we're focused on maintaining people's health going forward, where we can make sure that no one is left out of the larger system. If we can begin to find the resonances with faith communities and our message, if we can begin to speak to them and find ways to bring them into this larger movement, we are exponentially expanding our vision. We are tying into a significant moral core. We are really making sure that we amplify our message with communities that not only need to hear it, but that would resonate with this larger message. I hope that helps answer some of your question, Chuck.
Oh, absolutely. I'm just making those conceptual connections feels real to me. And having listened to, or having been with you in the room,
Mm.
and listening again. It just, I find it powerful just to hear your words and your thoughts again as you essentially paraphrase yourself, but do so in a way that is the relationships. What does that look like, and how do we give folks a sense that they can then believe in themselves, that they can connect here and we can connect there, and that we can change the world for the better?
Thank you for that follow-up question, Chuck. I think one of the first things I'd say is that all of our faith traditions have at their core the notion of empowerment, the notion of the fact that you are sacred, you're special, that God cares about you. Your voice is significant. So I think in part, building off of the messages of faith communities that valorize human worth uh, is a beginning point, is a first step on a much larger trajectory. As citizens of the United States of America, one of the things I've always been motivated by, I was trained in part in organizing under the Saul Alinsky paradigm with the Industrial Areas Foundation. And part of what I learned in that training was that every human being has power. We have agency, and we have the ability to express that agency. We need to begin to recognize that and reclaim our power, because you're right. The world in which we live is trying to take power away from people. It's trying to make them think you don't have a choice in healthcare. What we give you is what you have to take. Not only that, you don't have a choice. We're trying to eliminate your ability to vote in this nation. Voting rights are under attack. But we have to recognize that we do have power, we do have agency, and we can utilize this. And not only that, but that the power and agency that we have is amplified when we bring our voices together. So each of us has our own ability to effectuate change. But when we join with others who have a common interest and common concerns, and we realize that the issues that we find that we are animated by. So we're here today because we're animated by the notion of a desire for a single payer healthcare system. But if we join together with people that are concerned about voting rights, because we're going to need to make sure that voting rights are protected in order to get any bill that we want to get passed. If we join together with people that are concerned with housing, because you know that you can't have healthy people if they're unhoused and they're finding themselves living in the street. And we join with people that are concerned about living wage and making sure that everyone is paid a fair and living wage. Then not only have we amplified our voice in our own silo, but the constituent areas around which we also need to have victories. We're amplifying our voice there. And this is the need for, in this larger day and age, a fusion movement. The notions of intersectionality and fusion, this ability to move outside of our silos, link with others, and work together for greater issues of justice is a larger imperative. I want to say something that's sort of a little bit off script right now, if you don't mind. But I think that this is another reason that we need to work for an issue of racial justice as well. When we think about a lot of people I know, and I'll just use one movement I've worked with, a lot of people, for example, in the environmental justice, climate justice movement, have often been hesitant to talk about issues of race. And they said, you know, that's a significant issue, but we're worried about the destruction of our planet. And so let's worry about the destruction of our planet. And then once we finish that, we can deal with issues of race. And the point is, they're missing a larger point. In essence, we need to deal with the issue of race because not only are people being disadvantaged and disenfranchised because of the color of their skin, and that hurts them, that they're living in these ways. Not only are people living in communities, Black and brown folks more likely to deal with higher instances of asthma, chronic disease because of the environmental pollutants in their community. Not only is the issue impacting Black and brown folks, but because the larger attack on voting rights is targeting Black and brown people's votes, and they tend to vote for progressive issues like the issues that we stand for. By not standing up for the rights of Black and brown folk, we are undermining our own power. We're undermining our own ability to have a larger constituency stand with us, vote with us, work with us for substantive change. It should be all of our responsibility to lift up a paradigm for racial justice, realizing that as goes the Black and brown community, eventually goes the progressive community in America. So it behooves us to learn how to work together, to amplify our voices, to work beyond the silos in which we are. And I don't think we really desire to put ourselves in silos. I think the larger systems of the world want us to be in silos so that we don't learn that our true power is the power of connectedness and working together. I don't know. I hope I've at least touched on some of the things you wanted me to touch on there, Chuck.
Yeah, absolutely. And I'm thrilled that you expanded the conversation into the larger strategic vision that I mentioned at the top of the discussion here, is that we need in this place, in this space, to amplify your shared vision. And you as a board member with One Pair States have helped us to articulate with other BIPOC members on our board. We want to look like America. We want to be truly a value-centered place where people feel comfortable and we can articulate those connections from healthcare to health for all. And health means, as you've alluded, it's about housing, it's about food, it's about jobs, it's about police reform, as well as climate change. So unless and until we connect ourselves, we're not going to have the power to win on any front, I think is what you're saying, if I can paraphrase. So what are some of the ways, maybe just get into some of the nuts and bolts of what does it look like, or what is an effective way to connect again with communities that may not feel like a comfortable place for some of folks here, but how do we build these relationships? What does that look like? How do we build trust? How do we build connection? How do we get the message out, respecting people's limited time and capacity to do certain things? One of the things we talked about was, I'll stop there and see what your thoughts are on what exactly we need to do.
So, thank you. As I think about what it is that we exactly need to do, I don't know where we need to end, but I think I know where we need to start. When we're reaching out to the faith community, I think we need to begin to present our message in a way that has a hermeneutic, a interpretive principle that reaches out to faith communities and make sure that our message makes sense to faith communities. So that which I talked about in my first answer is, I think, a starting point. How do we develop a faith-based hermeneutic that responds to the issues of single payer, the issues of healthcare for all, in a way that resonates in the ears of people of faith? When reaching out to communities, Black and brown and Latinx and Indigenous American, I think we also need to think about how do we lift up issues of concern for these communities as part of this effort as well. Knowing that African American communities have excessively high instances of asthma, diabetes, heart disease, explaining the way that this will be a mode of building towards equality, utilizing that civil rights language of justice and equality for all, and framing this in terms of the fact that what we're working for is a system where, whether you're Black or whether you're white, whether you are young, whether you're old, you can all have equal access to healthcare. Black and white, we know the significant differences in treatment between Black and white communities. But this is a way of moving towards greater equity there. Young and old, we know the significant differences between those who are able to have access to Medicare and those who have to struggle, hopefully finding themselves access to the Affordable Care Act. But many people in the state of North Carolina are still not able to gain access because they fall into that donut hole, that gap where we've refused Medicaid expansion, and therefore they don't have access to health care. But a single payer system would provide access to all of them. So this is utilizing the language of justice for all and framing things in a way that reaches this community would be significant. And this is the same thing for Latinx communities, the same thing for Indigenous American communities, utilizing the notion that we're working towards something that brings us all to a greater sense of oneness. I've been in conversations with of late with a group I work with of people for education on the superintendent's advisory committee. And one of the things that we've been talking about, Christians, Jews, Baha'is, Quakers, UUs, one of the things we've been talking about is that in each of our faith traditions, we have a vision of oneness. There's a notion of that all human beings are valued equally and need to be lifted up in that way. But we don't tend, when we talk across faith lines, we don't tend to lift up that common notion of oneness. How do we utilize that oneness in our school system in a way that helps people to move beyond violence, helps people to think about the significance of not just the white schools in Myers Park, but the Black schools in the Hidden Valley area? How do we use it to talk about moving towards a greater standard of equality for all of us? And I think the same is true for our movement. We need to begin to surface that common notion of oneness that exists in all faith traditions and utilize that as a framework to move forward with. A concept of oneness would want a healthcare system that serves all of us equally. This is what oneness might look like in this way. How do we surface these themes as we move forward? I think those are some sort of nuts and bolts beginning points for this larger work. I think other more tangible, pragmatic steps might be convening meetings of leaders of faith, going out to meet with collections of people of faith in their own context. So instead of saying, we want to invite you all to our meeting, I say, we know that the National Baptists of America are having their convention. Let's go have a conversation with their leaders while they're there. We know that the AME Zions are having their annual meeting. Let's meet with the AMEs. Let's meet with the AME Zions and have a conversation with them in their own context. We know that the Hip Hop Caucus is bringing together hundreds of people to talk about issues of climate justice around the country. Well, what if we went there to talk about the way that healthcare is important if we're going to talk about climate issues, because one of the reasons we care about climate is because of the way that it impacts people in the larger world. So how do we begin to make ourselves available to enter into the spaces where people, Black and brown people, people of faith, already are present and present what it is that we're trying to do to them directly? So that's just one pragmatic way of reaching out and beginning to foster relationships necessary to move forward.
Yeah, and even more concretely, what we talked about is putting together study guides, yeah, I guess like a study guide for how to work particular communities and to engage them using language, values, and connection that will resonate. Because again, the problem of people just being bombarded by false messaging all the time, which leads to the next question of we're living in a world of anti-truth. We're living in a world of anti-science. We're living in a world that's increasingly anti-intellectual, anti-reason. So maybe speak to the importance, even the greater importance, of connecting to people where they are and how they look at the world, given that overriding phenomenon that we're experiencing.
Yeah, and this is increasingly a difficult issue and one that I've puzzled over so much. How do we valorize truth in a world that has determined that truth is completely relative? This is much further than postmodern theory would ever take this larger idea. Where we are today, where truth can be whatever you think it to be in that moment, and people stand up to support their ideological positions as though they were true. I think getting back to our core faith values and lifting this up, all of our faith traditions are built around a premise of some sense of truth in a less subjective way. And though I would always wrestle with notions of objective truth. I would say that at least having a conversation within the context of faith community does provide for a different set of norms, a different set of values. If we can utilize a commonplace like the Hebrew Bible, the New Testament, the Quran, as a basis of collective truth, and utilize that to frame the conversations we have, then hopefully we can begin to counter the tide of ideas that are, in essence, the manufactured propaganda of partisan politics. If we're able to tie what we're doing to these greater sense of values that resonate in the hearts and souls of people, I think we're better able to do that. But let me move away from just talking about faith community to talking about American identity again as well. Because I think that our American identity has been compromised by this, the relativation the relativization, I'm making up a new word here, but I have a PhD, so that's okay. The relativization of truth. Uh, but if we could return to talking about the commonplace of the Constitution, the Declaration of Independence, and using them to frame what does our notion of truth look like there? What does our notion of a just democratic society look like there? And let's utilize such language when we engage in conversations to talk about how, contrary to the notion that Medicare for all is a socialist exterior idea that's thrust on us, it is an idea that resonates with the notion of commonwealth. We are a people who came together to promote the commonwealth. This is an expression of ensuring that our neighbors are able to gain access to the same mode of healthcare that we have. I think we need to better utilize our collective commonplaces, be it faith-based or be it national, national-based, nation-based, patriotic core principles and values. We need to make better use of them if we're to counter this sort of tide of propaganda masquerading as truth.
And then last question I'm going to ask, and we can open it up. Maybe Mike, if you can tease out a couple questions that are kind of repeating in the chat. But one of the responses of faith communities that's problematic to some degree, but understanding what it is, Mike actually came up with this question, which is the propensity toward charity, and also the phenomenon of philanthropy in our society. That, you know, somebody rich will take care of my problems, or this faith community will take care of my problems, but then we're just perpetuating the system, right?
Amen. Amen. I think we are 100% in need of moving from charity modes of responses towards something different. And I don't want to ever cast aspersions on charity models of responding to people's needs. A charity response to homelessness is, we have a program called Room at the Inn where you can spend the night in the church if you're without a home. A charity response to foodlessness. In Charlotte, we have something called Loaves and Fishes, or we have food banks where we give people access to food to help them through their needs. And these are wonderful responses necessary to help people through difficult crisis moments. But the larger point is, instead of Room at the Inn just saying, you know, we've got a place for you to stay tonight, the Room at the Inn should be asking, why is it that people that work full-time can't afford an adequate place to live? Instead of just saying that we're going to give you 2 weeks food with loaves and fishes, and then you can come back in 3 weeks for another 2 weeks supply of food, which is necessary. What if we said, why is it that people that are working full-time jobs or forced into part-time labor can't afford to get adequate food for themselves? What we'll end up finding if we start to ask these kinds of questions is that the problems that we see with poverty, the problems that we see with a lack of access to healthcare, the problems that we see with so many things in our society have less to do with individuals who are broken and more to do with a system that is broken. In essence, what I'm saying is we don't need a charity response. We need a justice response. We need a response that challenges the overall system. We need a response that begins to suggest that the way that we do things has benefited a small handful of people at the expense of so many others. We need to look at the way that privilege has given great advantage to some at the expense of others who've been left out to suffer, left out to struggle, been forced to deal without. I often tell the story of my daughter's school and how I used to go to school in the morning, drive her to school in the morning to drop her off, and I'd get in that line. And the line was two ways, go in this way, come out the other way. And as we would get in the line, since there were fewer people coming out, every once in a while, somebody would cut out of the line and they'd go forward and then they'd get in the line in front of you. And what that showed is that every time somebody came out and took an advantage, they put the rest of us at a disadvantage. And what that showed me is that always when we give people privilege in a system, we privilege the top 1%, the top 5%. We privilege those people who have health insurance and against those who don't, and utilize that privilege as a way of helping mobilize them against a larger healthcare system. Whenever we have privilege in the system, it comes at the expense of someone else. It costs someone else. We don't just need to do charity responses to care for those who are left out. We need to begin to change the overall system to make it more just, more fair, more equitable. Tzedek, tzedek, tirdof. It says in Deuteronomy chapter 16, verse 20, justice, only justice shall we pursue. And we need to be about that as systems, as people within broken systems, I should say. And let me come clean and confess. Systems aren't broken. The systems that we have are working just the way they were intended to work. The people that are left out are the people that we intended to leave behind. The people that are benefiting are those that we intended to lift up in the system. We have to recognize that the system is working the way it was intended to work, but that fundamentally is wrong. So we need to, and this is why I call the project that we've been working on here in Charlotte, Reimagining America. We need to begin to reimagine our overall systems, to think about what it would look like if it was just, and then work to manifest that in the larger world. That will help us with healthcare, that will help us with education, that will help us with voting rights, that will help us across the board. Reimagining and recreating a more just, more fair, more equitable system instead of just providing the Band-Aids, necessary, however they may be, that charity responses provide.
Dr. Bill.
Thanks, Mike. Thanks so much, Dr. Sadler. So great to see you and hear you, as always, feeling inspired as a result. I just brought up in the chat about the example in history of the pastor, the rather famous pastor in our movement, Tommy Douglas in Canada, who of course led the movement coming out of the Great Depression in rural Saskatchewan, and had a way, I think, of speaking, one-on-one with folks in their homes, at the kitchen tables, those kinds of discussions that led their movement. And I think it's not a fluke of history that it happened that way. And Tommy was, I think, particularly fond of talking about the multi-tier, the inequity and injustice in healthcare. So I'm thinking from your perspective, do you see something like that as perhaps what would make our movement actually achieve the justice that we're all looking for?
I love that notion of beginning that face-to-face, one-on-one relational kind of work. And I think that if we're to be successful as a movement, it often comes at that expense. I want to lift up just someone that we've talked to today. And Dr. Bill, it's always great to be in conversation with you because you live this out each and every day. One of the reasons that Joel Siegel has been such a successful organizer over the years is because he's a man who loves to have those one-on-one conversations. I've seen him in public spaces just sort of walk up to people. I start conversations with people who are behind counters and say, how are you doing with your healthcare? Really? What would be a better healthcare system for you? Huh? Really? What if we were able to tell you that there's a strategy in place to put something like what you talked about in place? Would you be willing to come to a meeting and talk a little bit about that? I think we need to be able to have that sort of ability to engage with those who may be interested in the work that we're doing, but have never been invited in and never realized the power that they have to effectuate change in the larger system. And we need to help people to realize that, give them a sense of their own empowerment. And we're not empowering them, but we're just letting them know you do have that power. You do have the ability to make the kinds of changes that you'd like to see. If the more we're able to do those kinds of things, engage people, share with them the vision that animates us, that motivates us, and invite them to come in. One of the other things I'm going to say is whenever we bring people into the larger movement, we've got to give them something to do. It's not, people don't want to come and just sort of sit in meetings and listen to talking heads talk. They want to do something. So give them something to do. Why don't you send out letters to the people in your neighborhood? Why don't you go with us when we will meet with our Congress members? Why don't you just talk to your family members over Thanksgiving? And here's something you might say. This is a brochure of a few points, talking points that you might like to bring up with members of your family as you go. We need to begin to do more of that if we're going to amplify the power of this movement.
Yeah.
Storytelling is significant. And in essence, what we're trying to do, all of what we're trying to do now, is we're trying to tell a different story. We're trying to bring us all into a different narrative. And the narrative that we create together is one that will be better than the one that exists right now. So how do we tell that better story, and how do we bring people in to buy into that better story so that we can help to bring about a better world?